It's 2024 and you should be getting phenomenal success rates at any fertility center you attend. But the reality is many people are not getting the success rates they need or deserve. What's possible? Just 10 years ago, we were getting success rates of 30, 35%, even with IVF. But now it's possible to get success rates of 80% or even guarantee a live birth. How do you get that? There's 3 approaches that are necessary. Number 1, an individualized approach to all fertility patients. You're unique and you're different from everyone else. Number 2, the most advanced technology and techniques available. And number 3, you need someone that can provide you with years and years of experience servicing clients from all over the world, because that kind of experience goes a long way towards treating you as an individual. What is individualized care? Well, that's super important to understand. Clearly, your biology is not necessarily the same as the other people in the waiting room with you. It's important to understand everything about your history and your partner's history before you move forward through a fertility journey, or things can be missed, or you may not be getting the optimized care you need. Examples, patients with endometriosis, they don't respond the same way that somebody else does. They can have lower egg production, they have higher rates of genetically abnormal embryos, and the miscarriage rates are higher. Did your fertility center even ask about that or explore it with you? It's critical to understand these things. If they just have a one-size-fits-all approach, that is not an approach that's going to get you those optimized success rates. So it's critical that the doctor understands and is knowledgeable about all of the different types of fertility experiences and presentations that people have. And you have to make sure that the doctor is actually attending to your needs specifically. You're not being treated like a number. You're not just another patient in a long list of other patients. PCOS is also critical. Many patients with polycystic ovarian syndrome, which is one of the most common diseases that we see leading to infertility, just don't get appropriate care. They're getting a very isolated, narrow-minded approach where they're just handed medications, or even worse, told, just go lose weight. The reality is you need a holistic approach to succeed with PCOS. You need medications, of course, things like letrozole, metformin, but more importantly, you also need natural supplements which can help with insulin sensitization, reducing inflammation, and above and beyond, you also need to have a healthy approach to your lifestyle, diet, exercise, and not diet where we tell people to go starve themselves, but quite the contrary, eating 6 meals a day can make a huge difference for patients that are suffering with this very common condition. Advanced techniques and technology are also critical to your success. We study incessantly through the literature, looking at every potential tool available to us to help patients worldwide. We demonstrate this every week on our show, Fertility Fact or Fiction, live on YouTube, where people come in from all over the world asking questions. In order to service their needs and be able to answer all those questions, you have to be knowledgeable and read nonstop. We use that reading and all the learning that we do to facilitate providing the highest quality care and the most avant-garde techniques and technology possible. Things like time-lapse embryoscopes, oocyte flushing from every egg retrieval, oocyte activation, and Neupogen media. We know the benefits of adding certain soluble substances to the media when we're transferring embryos, and what add-ons actually provide a benefit, things like PRP or embryo glue. We have all the data. We add that into our protocols, and we make sure that patients understand that they are getting the best possible care with every transfer. And now we're even evolving further using computer assistance with artificial intelligence to gauge what can be done in terms of prediction for your eggs and your sperm in the outcomes of your cycle. You can now use AI to determine, are these eggs going to become good embryos? And you can do it with the embryos themselves to determine if the embryos are genetically normal or not, and what chance they have of actually turning into babies. Having done this for 20 years, it is crystal clear that we have now become a destination fertility center for people from all over the world, all walks of life, sexual orientations, and economic backgrounds. We don't discriminate in any way, and we make sure that every single patient is provided with exceptional care at all times, and we try and custom tailor the care to your needs and your abilities and what you can manage in your own life. It's important to acknowledge that we're in Canada, and in Canada we have an altruistic model for all of our healthcare. So we go out of our way to facilitate the best care possible for patients at pricing that is extraordinarily competitive. Let's be honest, we can blow pretty much every other competitor out of the water because our prices are much lower, but you're getting not just the same care, but even better care than you can get in any other center. In reality these days, where fertility is big business and many centers are being bought up by other companies where the bottom line is money, for us, the bottom line will always be you.